Hi, this is Kathy Reagan Young with FUMSnow.com, and sitting here to my left is my right-hand friend,
Pelvic floor friend.
Yeah, my pelvic floor friend, that's right, Erin Glaze. And we did a little introductory of us and how we met and how we got together and what we're doing. So if you need to go back and watch the previous one, please do so. But just know we're friends and we're here to help. I have MS. She is a pelvic floor specialist, PT, and we're answering some questions. So if you have any other questions, please put them down below in the questions right below this video, or email them to me at Kathy, K-A-T-H-Y, at FUMSnow.com. So let's get to some questions.
Sounds good.
I have a combo bladder problem. I have urine retention problems and urgency, lack of control. When I have to go now. How can this be helped? I do use a catheter at least once a day, and I drink gallons of water and haven't had a UTI in years. Yay, you. The urgency and leakage are a real pain and can be embarrassing.
Absolutely. That is a great question because we're able to cover a lot of information based on that one question. When you talk about urinary retention or incomplete bladder emptying in combination with the urgency and frequency, you want to understand that those two things go together, because retention obviously means that you're not completely emptying your bladder. Okay?
You're retaining some.
Exactly.
Okay.
You're retaining some urine in the bladder or incomplete emptying. So if your bladder has a capacity of 400 to 500 cc's or milliliters, and you feel an urgency to go at 350, 400, when that urgency hits, you head to the bathroom. Suppose you're only able to empty about 100 cc's, but you're drinking gallons of water. That urgency is going to come back. The frequency and urgency will be greater because you haven't allowed your bladder to completely rest in between. So that brings up the question or the possibility of what we call dysfunctional voiding, meaning that when you go in the restroom, you're actually not allowing your pelvic floor muscles to relax and empty your bladder. So Kathy, imagine that your bladder is like a water balloon, okay? And it's pliable like a water balloon is. And your pelvic floor muscles would be like your hands holding the bladder up and holding it closed.
Okay, got it.
The two are very separate, distinct things, entities, okay? The bladder has a mind of its own and the pelvic floor has a mind of its own, but they speak to each other. Okay? Does that make sense so far?
I'm following you so far.
So when your bladder reaches a certain fullness, there are stretch receptors within the bladder wall. And those receptors communicate with you and say, I have to go to the bathroom.
Right. It's touching me now.
Exactly.
That means, yeah.
Right.
Let some out so that it'll shrink up and then it won't touch me. I don't like it touching. It's like my kids. She's touching me. She's touching me. She's touching me. She's the receptor.
Exactly. Exactly. And that receptor sends you the signal, oh, I have to go. Well, when you're a child, you learn bladder control, and your part of that bladder control is your pelvic floor muscles. Remember, they hold up and they hold closed. They actually contract a little bit. Okay. So that you have time to get to the bathroom. Yeah. And when they contract, they send a signal to your bladder and to your brain. Hold on, we're not ready to go. Okay? So they're holding kind of more tightly. All right? So that is a great tool to use to inhibit bladder urgency, is to do a gentle Kegel. All right? And we're going to have definitely more information about that in relationship to inhibiting urgency.
Yeah, separate will show you how to do them correctly, not this one.
Right. But in the context of this question and having the retention and frequency and the potential of having dysfunctional voiding, we now have this full bladder that's yelling at you, I have to go to the bathroom. And you have a muscle that's holding more tightly. Okay, so you make your way to the bathroom and you become aware, I'm in the bathroom, I need to go. All right, now a lot of times people are in a hurry It's like, let's get this over with. I'm sick of being in the bathroom.
Right.
I want to be done with this. So you sit down and you start to push. Well, when you push, your muscles think you're pushing your bladder out because remember, they're holding you up.
Okay.
They're actually going to contract more, and they're already tight.
Oh, the bastards.
Exactly.
Come on, work with me here, would you?
Exactly, but that's it. The frustration of, I have to go. So you push, muscles contract, you get a tinkle, and you're like, I'm done, I'm out of here, let's go. What isn't happening is that the muscles aren't relaxing. Again, think back to the water balloon.
Got it.
You have the water balloon.
Relax and release.
Holding. Relax and release. There you go. Key phrase,
Tag
relax
one.
and release.
Just
love
born.
it. Love it. Like my pelvic floor friend, right?
Yeah, right.
Okay, so the bladder pushes, the pelvic floor muscles should relax. If that doesn't happen, you don't completely empty your bladder, and you have to go again more frequently, okay?
So the stuff that's going on down here is really affected by what's going on up here.
Absolutely.
So you have to take the time and think about it.
Absolutely.
And
don't strain.
Strain, there's no gain.
Awesome.
Release to find peace.
Awesome. You should remember those mantras. So let me do a little add on to that. So when you go to the bathroom, this may sound weird, but you should go in the bathroom and you should actually close the door, take a deep breath, and don't rush. All right? How hard is that? How hard is that? Exactly. Do a little whatever you do to allow your body to relax. And also positioning can help. All right. Positioning also helps with bowel movements. Again, another topic. When you sit down, you can sometimes push up on your toes a little bit. See how I'm going to use. Lean forward, keep your back straight. Take a deep breath, breathe into your belly, and relax.
And lean forward, did you say?
Oh, lean a little bit forward. For some people, that helps. Not everybody. Some people might get a little better flow leaning backwards. Kind of depends on the position of things down there. But you can always try this.
And that's different on everybody.
Yes, it is. Based on number of babies you had, male, female, all those things, okay? So you're in the bathroom. You've closed the door. You're taking a deep breath and you're saying, this is my moment of peace. This is where I'm just going to chill for a moment. Allow your bladder to do its job while you allow your pelvic floor muscles to relax. If you push, you're contracting.
Not good.
Yes.
Not
relax, release. Then I'm going to show you. Stand up, sit back down, relax, and try to go again. When you stand up, you kind of reset things a little bit. It's called double voiding.
Wow.
Okay.
Very cool.
Anything smarty pants about that? Come on.
Oh, God, had you told me that before, I'd have had a chance to do that. All right,
double voiding. So you go in, you relax.
Jeopardy?
Exactly. You push up, you release, stand up, sit back down, release again. Give yourself adequate time. This does not mean sitting in there for 10 or 15 minutes. This means sitting in there for maybe 3 to 5 minutes. If you sit for longer than that, you're kind of training your body that you're going to get all that time in there. Relax with it, 3 to 5 minutes, which is actually an extended period. Most people don't sit in there for 3 to 5 minutes.
No question.
But you're giving yourself time. You're taking some deep breaths, and while you're there, go ahead and let your body relax too. Release some tension through your shoulders, head, all that. It's all good. Next part of the question. That's dysfunctional voiding. Okay. Tips of the train to help urinate more completely. Okay?
Okay, so what are we talking?
Second part of the
drink
question.
gallons of water.
Right.
Should you do that?
No.
I mean, there's questions of how much is too much, right?
Right, exactly. And this question was written with, I'm drinking gallons of water. Perhaps not really gallons of water. Have a sip. A lot of water is good, or a good amount of water is good. If you're drinking gallons of water or large amounts of water, you're going to have to urinate more frequently. That's normal. That means your kidneys are doing what they're supposed to be doing and everything's working. Exactly. So what is a good amount? It depends on the person. You shouldn't be thirsty. You should try to drink the majority of your water in the earlier part of the day. So if we're going to say, okay, 6 to 8-ounce glasses of water in a day, lovely. If that works for you, that's great. I wouldn't drink much less than 4 to 6 glasses of water in a day. Right. 4 to 6 is a good amount. Some people do better with more. If you have constipation, you might need more, okay? But remember that, because sometimes we're so focused on doing more is better. Great. And I'm not saying not to drink gallons of water, but recognize that those gallons will make you go to the bathroom.
Yeah, that translates.
Okay? Exactly. And that's okay.
Must come out.
Exactly. As far as keeping UTIs clear, helping with bowel movements, all very good things. I also like this question because she is saying, okay, if you have a component of overactive bladder, some people will go the opposite way and drink less water. What that does is it creates a concentrated urine in your bladder, which actually makes you have to go more frequently. Okay, so that's not good either.
Counterintuitive.
Exactly. You think if you drink less, you'll have to go less.
Right.
But that's not the case in a lot of cases.
Right.
Okay, so a good amount of water, not an excessive amount of water. So we've kind of talked about a few things. One, using Kegels, and we're going to talk more about Kegels, how that can help inhibit an urgency, because remember, it talks to your bladder and your brain, says, calm down, give me time. How thinking about when you go into the bathroom, if you're relaxing, not pushing, not straining, but allowing a good release.
Strain, no gain.
Stand up, sit back down,
Release.
Exactly. And finding that balance of water, I think that's going to be really helpful. So I think that's a good question.
answer.
Good
Cheers.
question. Thank you so much for sending that question
Yeah,
in.
keep the questions coming. Put them right below here, or send them to Kathy, Kathy, at fumsnow.com. Remember, we're writing an ebook about this. We'd love to answer your questions here and in the book. We're also going to be doing a podcast, but that's another story.
I didn't know that.
Yeah.
I'm kidding.
We are. So you can go to fumsnow.com. Yes, it does stand for what you think it does. fumsnow.com. And you can sign up for the newsletter right there on the homepage, and you'll be amongst the first to know when the ebook comes out. And there's lots of tips and tricks for living your best life with MS anyway. So thanks for joining us again today, and keep checking back. Subscribe to the channel here, and you'll get notified too. Thanks, Erin.
You're welcome.